This week, more troubling signs for Minnesota's uninsured rate, and Madelia Health is rolling out its plan to try and save itself. Welcome to the May 29th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
There are yet more signs that the number of uninsured Minnesotans is rising and is poised to expand even more next year. Two federally qualified health centers told KSTP-TV this week that they're seeing a marked rise in uninsured patients coming through their doors in 2026. Executive Director Ann Kazaban said 39% of Southside Community Health Services' 12,000 patients last year were uninsured.
And we're anticipating that to grow, 10 to 15% easily by the end of this year. And then in 2027, who knows?
Southside Community Health Services is one of more than a dozen FQHCs around Minnesota that provide free or low-cost health care. Another, People Center Clinics and Services, reported about 20% of its patients were uninsured, but that number is also growing, KSTP said.
That follows a report in March from the Minnesota Department of Health that Minnesota's uninsured rate rose sharply last year. Data from the latest Minnesota Health Access Survey said the state's uninsured rate increased from a historic low of 3.8% in 2023 to 5.8% in 2025. That's about 116,000 more Minnesotans without health insurance. It's the highest uninsured rate for the state since 2017. The Minnesota Department of Health also reported in March that uncompensated care at Minnesota hospitals rose to an all-time high of $444 million in 2024, up by about 25% from the year before. Also, Georgetown University this week reported that more than 1.7 million kids nationwide have dropped off U.S. Medicaid rolls since last year. And as of March, Politico reported that 1.2 million people enrolled in health insurance under the Affordable Care Act have dropped their coverage, out of 24.3 million enrolled last year. And that's before federal changes to Medicaid take effect, which are expected to drop 140,000 Minnesotans from the program starting in January. The Minnesota Hospital Association told lawmakers this spring providers expect to lose $350 million in Medicaid revenue a year.
Also this week, Madelia Health said it was launching a $5 million fundraising campaign to stave off financial challenges that have threatened to close the South Central Minnesota Hospital and its clinics. The Star Tribune reported earlier this year that Madelia Health had negative 12 days of cash on hand. KEYC-TV said the Madelia Health Foundation was asking for donations, offering naming rights to its facilities, and exploring a so-called program-related investment, a repayable charitable donation that could support Madelia Health on a short-term basis. Brent Christensen is the chair of the Madelia Health Board.
I fully believe, and I am completely confident, that we will get this fixed, and we will get the short-term fixed, and we will build the long-term so that we don't ever have to do it again.
KEYC said the effort is just starting and has raised just over $14,000 so far. Madelia Health has about 200 employees and reports about 1,100 inpatient days a year. Many consider it a bellwether of rural health in Minnesota, where many hospitals outside the state's urban centers are facing growing financial challenges. Other news in Minnesota this week, Children's Minnesota named a new chief medical officer, bringing in former MHealth Fairview Vice President of Medical Affairs, Dr. Samir Gupta. He starts his new job August 1st. And another new position made headlines in Duluth this week. Essentia Health CEO David Herman is joining the Joint Commission's Board of Commissioners. The Joint Commission is arguably the world's premier accreditation agency for healthcare providers and is governed by a national board of 21 commissioners. They include hospital administrators, American Medical Association leaders, healthcare executives, and medical educators, among others. And finally, a note on mental health in Minnesota. Governor Tim Walz this week signed the Kayla's Hope Act. The law will develop design criteria for bridge and other construction projects to incorporate suicide prevention features, according to the Minnesota News Network. It will also gather data on bridge-related suicides to identify high-risk areas. The bill is named in memory of 29-year-old Kayla Gable, a mother of two who died after she jumped from the Washington Avenue Bridge in Minneapolis in 2023. That's it this week for Healthline, a weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mochtig.
Thanks for listening.